Thanks for staying tuned. You are still watching iBrand Daybreak. Now, the National Primary Healthcare Development Agency has said over 70% of medical drugs being dispensed in Nigeria are substandard. According to the agency, the country is faced with a number of healthcare challenges. It stated, and I quote, "The majority of Nigerians do not have access to health services. 20% of all maternal deaths globally occur in Nigeria. Infant mortality occurs at a rate of 19 deaths per 1,000 births. Children under 5 are dying at a rate of 128 per 1,000, and over 70% of medical drugs dispensed in Nigeria are substandard." Joining us to discuss this over the phone is pharmacist Mary Enenye. Welcome to the show.
Hello, good morning.
Thank you so much for joining us, Dr. Mary.
Yes.
Now, let's critically assess this issue of the fake drugs, saying that 70% of drugs in Nigeria are fake. How does that come to you? How does that news come to you?
Sorry, I didn't get that.
The news or the discovery that 70% of drugs in Nigeria are substandard. How does it come to you?
How does what?
How does it come to you? What's your perspective on that? What's your take?
Oh, okay. I would say, I don't know where they got their statistics from, but I would say they're quite correct. Yes, we have a lot of big drugs in Nigeria. Of course, it's Nigeria. So I think it's a very bad state for the country if we can't afford authentic drugs. And these are medicines that we need, people need to use in the country. Like, okay, for an hypertensive patient, the person needs to have the drug and has to have the authentic ones, the real drugs. Because when we give them drugs that are substandard, it's more like you're worsening the case for them. We have a lot of funny reactions and are really not good. So it's a really bad state for Nigeria if we can't afford to have authentic drugs. If we have substandard, it's really bad.
Well, considering that high rate, 70%, that's just too high. What do you think? What are the measures you would suggest that the Ministry of Health, in collaboration with Nphcda, should put in place to ensure that substandard drugs are reduced to their barest minimum within our health sector?
Okay, so these are the things I think they should implement, because if we're looking at substandard drug as a thing, there are things that causes it, yes. So if they could address those issues one by one, I think the rate at which substandard drugs are circulated in the country will drop drastically. So one of the cases of why we have substandard drugs in Nigeria is because we don't have good manufacturing practices. So anybody can come up and decide they want to manufacture their own drug, give it their own brand name, and the regulatory bodies are not really doing what they should do to help this menace. So if we could have good manufacturing practices in Nigeria, good manufacturing practices in that the machinery we should use, the excipients, the active ingredients are there. When these are checked, of course, it could help to reduce that number. Also, we may have good manufacturing practices, but some of these companies may not have a good quality control in it. So it's one thing for the drug to be produced. It's another thing for the drug to actually do what it says it's going to do. So let's say I'm manufacturing a tablet. I put in everything I need to put in the tablet. I put in the active ingredients, say paracetamol. I put in paracetamol. I put in the excipients, starch and binders and all things that can make it form the tablet. Okay, I'm done with it. I can see the whole tablet. Now it's white, it's cold, it has everything it should have. But then when the quality control takes it, they try to do some tests. They try to mimic what this drug, what our body will do to the drug, and what the drug will do to our body. So they take it and do this test, say disintegration test. The tablet doesn't dissolve in the test. Because of course when the tablet gets into your body, your stomach should be able to break it down for it to circulate, yes? So we did the test and it's not working. Or then we do quality assay and we find out that even the amount of of paracetamol I put there is not up to the strength for a tablet. The usual strength for paracetamol should be 500 milligram. And then they do a test and they realize that we got only 250 or 200 there. Or they do a dye test and they realize that dye test is to check that each of the ingredients in the tablet is uniformly dispensed. But by the time they do dye test and they see that it's one place is more darker than the other, that means that if it was a scotch tablet and they needed to break it to get half of that strength, you realize that one part might get excess of the strength than the other half of the tablet. So if we could also look into this, the quality control unit have a very good one and make sure that they do the right thing, because another thing is for them to be there and for them to do the right thing. So if this is also caught, definitely that 70% might go as low as 15, because of course there's always going to be errors in manufacturing and all. Another thing they could also do is they do regular checks. So NAFDAC can come up and say, I want to check this company. No information, no prompting. They just come and they want to check the batch from paracetamol you've produced today, and they do the regular checks they need to do. Because if all these are not done, people will do anything they want to do and get over with it and get away with it. And it's the consumers that are
at the receiving end. So I like the fact that you touched on the roles of regulatory bodies like NAFDAC, the NDLEA. But let's also look at your industry, the pharmaceutical industry. There's been complaints about the fact that a lot of people go to drugstores to purchase drugs without prescriptions. And we've heard of control measures being put in place saying that people should be able to provide a doctor's prescription before getting drugs. But this keeps happening. What is being done in your industry to curb this menace?
Okay, so yes, that's a major issue for us. It's really a major issue. Okay, we see patients that walk into a pharmacy and they just say, I want so drugs. Perhaps out of experience, what they used or what someone recommended for them some time back. And the sad part is they always come with the brand name. So they're not really sure of what they want. They just know that I use this drug and it's gave me relief. So please help me with this drug. They are bypassing the doctor's visits. They are bypassing pharmacy consultation. They just need that particular drug. So it's something that has been a pain in our neck, I would say. And what we are doing to curb it right now is we are trying to sensitize people to let them know you can't just walk up and buy a drug. You need specific information. You need to consult. You need to see the doctor. The doctor needs to write a prescription for you. Then you bring it to the pharmacist. Or if you were in an area where you don't have access to the doctor, you can walk into a pharmacy and lay your complaints. We are trained pharmacists. We are trained to at least attend to minor consultation issues. I as a person, I could, if to a long run, if you come to me in the pharmacy, community pharmacy, I'm able to let you know that, okay, by the time you tell me your symptoms, I can interpret that and give you a possible a drug that would help with that, depending when you're able to visit the doctor to do an extensive check. So we are sensitizing patients and the people we are sensitizing them, letting them know they can't just bypass these people.
But it's a two-way thing. It's a two-way thing, Dr. Mary. If you're talking about the patients, what about those who dispense the drugs without asking for prescriptions?
Sorry, those who what?
Who dispense the drugs without asking for prescriptions?
I don't want to believe any pharmacist would actually sell the drug to a patient without at least having foundation knowledge of what the person is complaining about. I don't want to think that happens.
I think
I worked in the community pharmacy for a while, and even when the patient comes to that prescription, I still talk to the patient. Let me know what you're complaining about. I just don't give people paracetamol because they ask for paracetamol. I don't want to think people that.
You can say that for yourself, but I think that's where regulation comes in, because there are a lot of people out there who call themselves pharmacists but aren't really pharmacists, because how do you explain the fact that you go to a pharmaceutical store to get a drug without having any prescription, and then he doles out the drugs without even taking those measures? Doesn't mean there's some loopholes in your industry.
We were in school, we were taught to be able to interpret symptoms to a drug. So I would not want to believe anyone says that really. I think they will still have, to an extent, have conversation with the person, know what, because you can't.
Sorry to butt in. And there are people who are practicing illegally as pharmacists. Are there people who are practicing illegally in your industry?
Oh yes, yes, of course.
So that's the issue.
Bad eggs, yes, of course. The standard body now for prescribing drug, for dispensing drugs as pharmacists. Well, we see people that we call them patent medicine stores owner. They probably learned, perhaps they're technicians, they probably learned from a store or something, and they open their own chemist. We call it chemists. They open their own chemist and they are dispensing drugs illegally. It's true. And from what I know, I think the Pharmaceutical Council of Nigeria is trying to curb that really. They are making sure that if you're dispensing the drug, then you must be a pharmacist.
Okay.
Or have a registered pharmacist in your premise.
Okay, just as we wrap up the discussion, how can the layman out there, the average Nigerian, know which drug is substandard or standard? And the reason I'm asking is this: we have certain drugs that would have barcodes or pin codes, and they are told to scratch and send to a certain USSD code and all of that. But do you have other means aside that to ensure that for patients to know this drug is authentic, this is substandard?
Really, I don't think of any other way you could, except what you just said. So that is why it's really painful to us, because there is no way we can know this thing unless it is done in a laboratory, unless qualitative and qualitative analysis is carried out. Once we get to the market, there is no way of knowing which. So it's always that it has to be made at the board. From the beginning, it has to be authentic. If not, with circulation down, you can't really check it, except they do the barcode thing, and you can get authentication messages that okay, your job is good.
Then that means every drug has to come with the barcode or the pin code, because certain common drugs do not have that. Your paracetamol, Panadol, and others.
It's advisable they do, but over time we are used to some brands that we know. Okay, these people are quite good, so we know that if it's coming from Enzo, we can rely on them to give us an authentic drug, or M&B or Swiffer. So sometimes we see, especially for some cases, some doctors will actually insist on a particular brand of drug because of the company, because they know, okay, we can rely on it, especially for people for patients that have undergone an operation, a surgery. It's not okay if just with any brand. So it's always good. They always insist on a particular brand. So the thing is, if it's not corrected in the beginning, sometimes you might really not know.
All right. Thank you so much, Dr. Mary Adeyi. Thank you for talking to us about this issue. We hope that the right things are done so that this issue can actually be tackled. We'll take a break now. When we come back, it will be time to talk money. Please stay with us.